Thank you, Dr. Angita and Sahani sir. Good evening and good afternoon, good morning. This is the 1403rd day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Aya Abraham Trick from Canada. Let us begin the session with 1 minute silent prayer. Thank you all. As you all know, the International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors. And we have 3 sessions in a row. We concluded our Hindi session, which began at 7 p.m. and up to 8 p.m. And the international session in English will start at exactly at 8 p.m. to 9 p.m. And from a local language session in Malayalam at 9 to 10. And we are very happy to say that all these sessions are going in a good way, and we are uploading our videos on the very next day itself, so that you can watch again and again and share with your friends, so that homeopathy will reach at every home. This is the purpose of what we are doing here. Not only that, we are able to connect the doctors from different parts of the world. Already doctors from 65 countries have participated. And today, our guest is from Canada. As you know, last Sunday also, we have a guest from Canada. And tomorrow also, we will have a guest from Canada. That means 3 presentations in a week from Canada is something great as far as we are concerned. And let me introduce the guest of the day, Dr. Aya Abraham Trek. She is a registered homeopath specialized in women and children health. She has presented some papers some earlier sessions, and she has an experience of more than 7 years. And the topic is very important one: remedies to help menstrual irregularities and menopausal phase. This is a very, very good an important area where homeopathic doctors can do wonders. And definitely Dr. Aya Abraham will share some of her thoughts and some of her experience in these sessions. And we proudly welcome all of you along with our guest of the day, Dr. Aya Abraham. Welcome, madam.
Welcome. Thank you so much. I'm very happy and honored to be with you today. I hope this session would be useful. As I can see, most of you are much more experienced, and India, it's where we actually learn homeopathy from. So for us, when we know someone who learned homeopathy from India, it's something very valuable. So I will share my screen now so that we can see the presentation. Start broadcasting.
Yes. Yes, your co-host, you can share.
Yeah, I think it's working. Let me open the presentation.
Yes, it's coming.
And here we...
Yes, yes.
Can you see it?
Yes, 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 we can see it.
Yeah, okay. So I think I will skip the introduction of what is homeopathy, since all of us knows what is homeopathy. I would like to specifically talk about the women health, and since this is my specialty, I get to see many women or even young girls, like teenaging 16, 18, who unfortunately have very irregular menses, and they can't do the connection why this would be happening, or how their hormone works, or what the connection between food, stress, or even emotional distress, like could be anger or sadness, how that can affect women health, especially menses, or for older age menopause. And actually that's a very important key while taking a case who come for menopause or for menses, they wouldn't do the connection, but it's very important for us as practitioners to try walk them through the case and understand what's beyond the reason of the menses irregularities. So and women, since most of the audience today I can see is men, they sometimes just need someone to listen. You can just ask an open-ended question like we learn, and they can tell you a lot of problems, and then we as practitioners, we can see how it started and what's her coping mechanism, and we can see why the menses got whether absent, whether very profuse, whether they come every 2 weeks instead of once per week, once per month. So that's, I just wanted to highlight before starting the session that there is always a story behind the menses or the menopause symptoms that women get. So as we know, we might have 3 different sections where women irregularities health can happen, whether the ovarian cycle, whether the menses, whether the menopause, and the different conditions that could be affecting menses alongside with the symptoms of the menopause or the menstruation itself is the endometriosis, the PCOS, uterine fibroids, birth control pill side effects, and this is in US and Canada. It's very widespread. I don't know if it's the same in India. Hormonal imbalances, inflammatory areas, recurrent UTI, and also any autoimmune diseases. All of them, in a way or another, they affect the women's cycle. So what are the different type of menses issues? Of course, most of you know that menstruation, a normal one would be have same pattern. They come at the same time, either every 25 days or every 28 days. Some people, they get it every 29 on 30. It's not ideal, but if it is regular, if the pattern is normal, it's not causing any other symptom to the woman, then it should be fine. Also, another point that is very important, now it has become normal to have premenses symptoms, while in reality this shouldn't happen. When we say, oh, you have your I lost the word now, you have your period, so you feel worse before the period, and that's actually not a must. You shouldn't be irritated before the menses or during the menses. The woman shouldn't feel more short-tempered. She shouldn't feel more pain. Some women get breast pain before the period. Some women get back pain before the period. Some people get food cravings before the period, and they tell you, oh, I know I'm emotional because I'm waiting for my period. A good hormonal system, this shouldn't happen. She can have some pain, but she shouldn't feel much difference in her state before having the menses or during the menses. I just would like to start with some definitions. Premenses syndrome, and some definition of what are the different type of menses that women get. So when we say dysmenorrhea, it's when she has normal flow, normal pattern, but the menses are very, very painful, to the extent that she might take a painkiller, or she might need to stay in bed, or she might need cancel going out of the house, or she can't do house chores. So the cramps are painful to make her rest in bed, and this, again, it's not a normal symptom. Hypermenorrhea is for some women who get really, really profuse, strong flow, to the extent that she tells you, if I just stand up from the chair and I stand up, I can feel flow. Or I have to go to the washroom every hour, or I change over 5-6 pads per day. So that's quantity shouldn't be that heavy. And also sometimes women who put a copper IUD, copper pregnancy ways to avoid pregnancy. Some of them who put the copper type, and that's also important piece of information to take during case taking. Copper IUDs might actually cause more flow and more pain. So in that case, we can help them with giving a remedy that gives the cycle its proper balance. Menorrhea, it's much more close to hemorrhage. So it's not only heavy and long menstruation. Unfortunately, you would find the women describing it as it have clots, the blood, it's very dark, and it causes her a real obstacle during her day. And of course, women who suffer from that type of period, usually they don't wait, they already go to a doctor, they already take medication, and when they come to us, it's because medication are not helping much, and they're trying to look for other solutions. So it's important to take into consideration the type of medication that women took, not only for menses but also for thyroid. Sometimes they are on thyroid medication, and that's also affect, as we know, in one way or another. The other extreme of the menses problem is amenorrhea. And amenorrhea, it's either you have girls who reach 16, 17, and they didn't get any menses yet, and that's started to consider late, or young women starting the phase what we call now perimenopause, 35 plus, between 35 and 45, and she starts to tell you, I get my period 1 month and then I skip it for 2, and then it comes, and then I'm not sure, is it a menopause already or not? So that's the absence or interrupted irregular menses. Those are the 4 main types of menses irregularities. And of course, there are many homeopathic remedies that can help all of these problems and help women to have regular menses. I will also define what is menopause, and then we jump into the different homeopathic remedies that can help. So of course, the biologic or the medical definition for menopause is the physiological cessation of menses as a result of decreasing ovarian function. So by this time, women, the fertility is much less. The body starts to go into a transition phase where menses become lighter, where they become irregular, and of course a lot of not only hormonal phase but hormonal changes, but other changes in her body that usually are affected by the hormones that are secreted during the menses no longer exist. Of course, the few famous ones are the mood swings, the hot flashes, the hair falling out, the night sweats are very common, headaches, osteoporosis. Of course, the bones are directly affected with hormonal changes, heart palpitation, memory weakness, and vaginal dryness. What I want to say about those symptoms, number one, not all women get all those symptoms, because sometimes we think that they might have 2 or 3 to check the list and say they have menopause. One woman could just have one symptom. And the memory weakness, it takes them a while. They don't come to you and you tell you, you know what, we have memory weakness. You will find her saying, I think I'm losing concentration. I think I'm forgetting. I find myself not focusing easily. So the memory weakness is not one that you can pick up quickly, but definitely the 3 symptoms that every woman will describe going with menopause would mostly be hot flashes, night sweats, and hair falling out. So those are the symptoms that we should take into consideration or think of if women are coming to us. They know they are in menopause. They are not asking for you to get the period back. They're asking you to help them through the transition. And again, it's very important to get the essence of the case and understand what could be this mother transition or this woman transition. You will be surprised that different women have different reactions while going through menopause. For some of them is grief, because it means like I'm aging, I'm getting older, I'm getting weaker, and I wanted to stay more younger. For others, it's like saying bye-bye to motherhood and childbearing. For others, it could be anger, like I'm not ready yet for this transition. For other, could be sadness and weakness, like why this is happening to me, why this is happening now. It's not happening in the right time for me. Like it's very, I cannot stress enough how it's very important to get the emotional state of women while taking the case during menopause transition or menses transition. So now the famous question, how can homeopathy help? And the way I structure it, instead of going through each remedy twice, I will say how the remedy can help if it is menses and how the remedy can help if it is menopause. So the first remedy that can help us is belladonna. And of course, the remedy picture is always reflected one way or another in our patient. So the belladonna menses, they are very strong, offensive. You will be surprised to find the description. She tells you, I find them hot, meaning the flow is hot when she changes the pads. When she feels the blood in the pad, it's somehow hot. And of course, it's bright red color. It's not brown, it's not dark, is not black. The redness is bright red, and sometimes they get scared because it's known bright red is related sometimes to miscarriage. So if that's her, when we take the history, and also women take time to be educated actually to learn about their period. And I'm sure that's something we face culturally back in Egypt, maybe in India, I don't know, but women take time to know their period, to know about their own ovarian cycle. What is luteal phase? What is ovarian phase? What is the menses phase? What is the follicle phase? They take time to observe their period. They take time to connect with their body when they have the period. And also that's part of the practitioner, to teach them to observe and to feel. The period is usually, whether irregular, means that it can come in different, one time it's 25 days, one time it's 28 days, so it's not punctual, or it comes earlier than it should come, or even it comes at a very early age. You find girls at 11, they already have period. Girls at 12, they already have period, instead of 14, 15, or 13. And of course, due to how girls eat now, due to all the hormones here on the west side, I'm sure that India still have very good fresh food. But on this side of the world, unfortunately, due to a lot of hormones in our food, a lot of pesticides, a lot of injections, it's been proven that girls are having earlier puberty, and that's affecting, they get hairs earlier, they get mood swings earlier, and we also need to take that into consideration while taking case of early girls. The pain of cramps is throbbing, is strong, and as we know, belladonna is most of right-sided, so she would tell you during ovulation week, I feel more pain on the right side, though during ovulation week, you shouldn't be having any pain. How can we use belladonna for menopause? Of course, again, you would find that the hot flashes, and she would tell you, I feel my face is boiling hot. I heard that. You would hear this description. It's not the type of menopause that stops gradually and you can say, okay, I'm saying bye-bye. It's, as I said earlier, 1 week, 1 month it comes, the other months it doesn't. It comes for 3 months and then it stops for 3 other months. So there is uneven circulation. There is a feeling of boiling hot, and we don't want to mix it with lachesis. We will talk about lachesis later. And the peculiar things about belladonna is that she has hot burning, hot flashes. Still her hands and feet are cold. And when you see the hot flashes or the flashes on her skin, again, of course, they are bright red, and she would describe them as burning. So what are the key features of belladonna during menses and menopause? There is this oversensitivity to touch, oversensitivity to light, oversensitivity to noise, and these are the examples that they want connected to menopause. She would tell you, finally, I find myself irritated by the kids. I find myself irritated by the TV loud voice. I can't go anymore to parties. Like, they won't tell you, you know what, I'm oversensitive to light right now. No, they will tell you stories, and you ask and you probe, and then you can get a full picture that she is having sensitivity from noise, she's having sensitivity from touch, and of course they get angry and irritated very easily over house chores, over kids' behaviors, over friends' attitudes. And while doing the DDX, we should differentiate between the anger and irritation of belladonna versus, of course, the anger of irritation of Nux vomica. How can we get some modalities? They feel worse when they're lying on the painful area. So if she has cramps on her stomach, she can't be on her stomach. When she moves, any sensitive area, it's worse with moving and worse being exposed to draft. They like warmth, they like quiet, and they like resting. So you would find her tells you, I leave everything and I go rest in bed, or I couldn't get out of bed. All these are the words or expressions that women use to describe how they feel. Of course, the second big remedy that we should expect help with whether menses or menopause, it has a huge affinity on blood, is lachesis. So with lachesis, of course, we already know how lachesis are. So they have the severe PMS, which is pre-menses symptom. And the very peculiarity of lachesis, they tell you we feel better once the menses starts. So the week before the menses, they are irritated, they are angry, they are short-tempered, they are very emotional. And once the flow comes, they feel better. And that's why there is thick discharge, there is profuse, there is staining, and the color might be greenish. And of course, lachesis is a left side. So usually lachesis help more with the PMS, with the week before the menses rather than the menses themselves. And on the menopause side, the hot flashes, the mood swings, they might have fainting spells. I didn't see it in practice, honestly, but that's we took it in literature. And hemorrhage of course. Remember always Lachesis blood, the picture of the remedy. And of course, they feel worse with any clothes around the neck, so they would always feel hot and they would express it. Like belladonna, they might not express it in their daily life, maybe during case taking, but Lachesis, of course, she would be complaining about it out loud with everyone. The key features of Lachesis is they have a headache beginning at the back and passing over the front of the headache of Lachesis. It starts at the back and become all over the vertex. Definitely they are loquacious, they are outgoing, they are energetic, so they will even be loud about their symptoms. At the same time, they would be prone to sadness, solitude, fears, and those are the emotions that they talk mostly about in the case. They are worse with touch, overheated left side, and they feel better with cool fresh air, with cool drinks, with onset period. Again, this is a key feature for Lachesis. They feel better with the flow and after moderate exercise. So now we talked about 2 remedies that can help with heavy period, profuse period, strong period, painful period. Let's talk about a remedy that helps with the amenorrhea, or the absent period, the irregular period, when girls need to have it more strong or more organized. So this remedy is pulsatilla. As I just said, usually we use it with young girls when either she's already 16, 17 and no period yet, or she gets the period but still it's on and off, or it's just 3 days, or it's just spotting. So it's not a proper period that starts at the same day and ends at the same day with light, heavy, light. That's a normal pattern of heavy period, changing color. It starts also bright and then it gets heavier and then it finishes with brown or yellow. So you have either an absent period, you have a late period, you have an irregular changeable period. Of course, changeable and pulsatilla, they match each other. So either it's very short, as I said, only 3 days, or this flow is very light, or they come to tell you we're not sure if this is period or not. What makes pulsatilla unique, or key feature, that they always have another vaginal discharge with it, whether it's bland white, whether it's greeny, it's greenish, it's yellowish, and they are very prone to vaginal irritation. So she might tell you, I get discharges during ovulation week, or of course they don't know it's ovulation week. I get discharge like 1 week before the period, and then I'm clean, and then I get the period. Or after the period finishes, I stay with few days a yellowish, whitish, brownish discharge. So it's a symptom for pulsatilla, where you have discharge next to the period. Of course, if older women, if they have uterus prolapse with severe back pain, it affects the period. That's usually happen, of course, after pregnancy and childbirth, 2, 3, or even more kids. So if in the history of the women, you're taking the case, she has menses problems, and she tells you, by the way, I have uterus prolapse, or I have severe back pain, it's important to take that in the background. How would the pulsatilla help in menopause? she she would always feel that the period is coming, but the period doesn't come. So she starts to have light cramps. She starts to have breast tenderness. She thinks that her mood is switching. She feels that the body is getting prepared for a period, but I don't get. And it's very frustrating because you feel confused. You feel like, is it coming? It's not coming. Why it's not coming? And that's you will find it frequently talked about from the case. They have heart palpitation, and the peculiarity of pulsatilla hot flashes would be alternating between too hot and too cold. Again, pulsatilla, changeable symptoms, and the overheating might trigger the hot flashes, and of course the open air will make pulsatilla always better. In pulsatilla, the mood swings are very strong that you that can help you I'm sorry, that can help you decide on pulsatilla with menses changes. As we know, they fear of crowds, they fear of dark, they fear being alone. It's easy to spot a pulsatilla child because they are demanding directly. How to spot a pulsatilla female? It's by how demanding they are. So you will find this patient telling you a lot of details. They are anxious and they would ask you and contact you, and they make like there is this demanding essence that they need your attention. They send you frequently messages. She tells you that today I'm good, but yesterday I cried, and 3 days ago I felt irritated. So the pulsatilla patient, though the menses symptoms are not very clear, but big part of it is, of course, her emotional state, her attitude, and as I mentioned, mostly is with absent light, weak menses. It's not with profused or strong, or menses are causing a problem. So that's pulsatilla. I know all these remedies, they are polycrests, but you would be surprised how when you know a remedy from a certain perspective or for a certain uses, you get a new image or a new picture of this remedy. Of course, sepia, it's another major female remedy that we all know and we all use. Sepia, I would say it's stronger than pulsatilla. It has a deeper effect, and it's when you feel there is heaviness to the story or to the emotional state of the case of the female. So sepia, the PMS or the pre-menses symptom week, she would tell you I feel a huge hormonal imbalance. How would you know that? She will tell you, I don't want to do anything at home. I don't want to cook. I don't want to clean. I don't want to be a mama. That's a famous sentence for sepia. She would tell you, I'm not ready to be a mom today. I wish someone would take the kids for me today. And she would feel all the motherhood responsibility very heavy, whether she's working or not, because I know we tell sepia the famous conflict between work or have her own life versus motherhood and wife responsibility. Regardless of that, generally during menses, 1 week before menses, she starts to feel like, I want to take a break, I want to take a vacation. And when you hear the story with other symptoms, you can tell that she might need sepia. So with sepia, it's important to highlight she might not have menses problems. She doesn't have any problem with the period itself, but she can find herself really, really moody before period or during period. And of course, when sepia comes to you, she doesn't tell you, I coming here for menses. She comes for the emotional state. And while you're taking the case elements and you ask about the period, you will find the pattern that usually this depression or indifference or the shutdown happens around the period. And also another peculiarity for sepia, the period is regular every 28 days. So that's also, again, we don't overgeneralize, but if you find her telling you, yes, my period is regular around every 28 days, the period itself is okay, flow-wise, pattern-wise, pain-wise, you might take sepia into consideration that my problem, her emotional problem, might be related to the period. So they sometimes get nausea and dizziness. Sometimes they get discharge, whether yellow, green. What makes sepia in DDX more prominent, it would be the itchy, does discharge make her vaginal itchy. And the difference between pulsatilla and sepia during the prolapse is the heaviness, the bearing down. So with pulsatilla, she will tell you normal back pain. With sepia, she will tell you, I feel I'm bearing down. There is weight down there. I feel the uterus is pressing down. And that's actually a very common it's a very common description that I hear about uterus prolapse and women feeling their uterus is heavy, is sluggish, is bearing down, is putting pressure on their vaginal area. On the other side, how can we use sepia for menopause? Sepia, we said belladonna and lachesis, the hot flashes, are very prominent. With sepia, sweats. They truly feel sweats, and they get sweaty with the least physical effort. The falling hair, the meteorrhagia, which we said they have a long period. So again, there is no pain, there is nothing wrong with the period, it's just longer than usual, and then it disappears. There is the hot flashes that make her weak with drenching sweat. Drenching sweat means profuse sweats. So that's the keynote that we would think of when they talk about sepia for menopause. We would think about it when we find there is profuse sweat. This remedy is sepia. I'm sorry, it's not pulsatilla, so we're continuing with sepia. Needless to say, the sepia personality, she would be an independent woman. And again, I need to clarify, very successful housewives or very successful stay-at-home moms could be sepia. Sepia women shouldn't be successful outside only. You would find her this mom that is focused with every detail for her kids. She puts them in different sports. She makes many activities. She plans vacations. So this, how we say it, I don't like to use the word workaholic, but this mother, effective, active, in control, making sure that everything is in place. This could be also a sepia who is not working, who is stay-at-home mom, who is housewife, but she takes her family as a job. If you get what I mean. And of course, the struggle would be not that I want to work. You would find that I want me time. I want to go out with my friends. I want to feel that I'm free of this responsibility. And that would be the inner conflict or struggle between herself. Of course, we know how sepia can be angry and irritated, and you'll always somehow find the sepia mother, the story is somehow related to kids and to responsibility, and that either she feels that this responsibility is forced on her, or she is over responsible due to childhood story where she had to always step up and to be a responsible kid, so she turned out to be the responsible mom. The element of responsibility is important in the sepia, and again, take that into context of women and in motherhood. It's very important while taking the case to relate to the mother that is talking to you in a way or another. They feel worse sitting still. They feel worse before period. They feel worse after staying long time before food. Of course, they feel better with heavy exercise, open air, warm in bed, eating regularly after sleep, and with firm pressure on painful area. Opposite to belladonna, who can't put pressure or can't lie down or can't touch the painful area. Of course, those are the small modalities that can help us during DDX, differential diagnosis. Another very famous female remedy that we use during childbirth, and also we use it in women health, is Sekal. Sekal is when you have the worst type of period that we talked about, the menorrhagia, where there is clots, the blood is not looking well, it might even be sometimes smelly. It's like somehow a type of collapse when she gets the period. So she has headache, she has gastric upset, she has dysmenorrhea, which is pain, pain that can be extended down the thighs, pain that is pressing. And believe it or not, sometimes they tell you, I feel as if I'm in labor. Every single area of this female area is hurting her one way or another. There is the pressure. She would tell you the cramps are as strong as a labor contraction. There is this abundant blood, dark blood, smelly blood, and it's like a gush, like suddenly you find big quantities coming down. It's not simple light one. With the least movement of my body, I get gush of blood. So that's you again. Unfortunately, that's answer I get when I ask her, tell me how was your period before taking medication, because it makes sense. Someone in that state, they won't stay that for long, and they don't know homeopathy yet. So it's also, again, if you have someone already on medication, it's important to get the menses period before medication, and see how after medication the symptoms are. And of course, the famous question, should we stop the medication while taking homeopathy? In my case, I prefer not stopping until we see progress with homeopathy. Homeopathy always work, even with medication. That's my personal experience. When she feels confident enough, she can stop the medication, especially something like birth control pills. You can't just stop that in a day or in a night. The Sekal is more for menses, honestly, they're for menopause, but for menopause, the symptom would be that she get one of those very bad heavy period, and then stops, and then it gets heavy, and then stops. So again, it's not the normal pattern where you gradually feel your period is getting lighter, whether the days are shorter. There is a gradual change, gradual transition, but here it's sudden, it's very fluctuating. And again, as a reminder, the purpose with menopause is how to help women to have this transition into menopausal phase easier and with the least symptoms or with the least harm. And the key features of SICAL, they are restless, they are very, very anxious, and there is this extreme debility and fatigue. We have this debility and fatigue in childbirth. We have this debility and fatigue with the very profuse bad menses. We have this debility and fatigue during menopause. They have constant thirst. They are worse with them, whether with draft, with touch, with movement. Like, they are worse with everything, and they only feel better in a dark room or sleeping. And that's also helps during childbirth, that she's tired and she tells you, I just want to sleep, I can't have this baby anymore. Those are the different remedies that I actually prepared for today. And as I started with the how can we do the treatment plan, taking the case, it's very important while taking while trying to regulate menses or menopause. The childhood history is important. The teen aging phase for women, when did she start the period for the first time, what was going on during that time, how was school and how was her social life during that time. Believe it or not, a period, especially for girls, is one of the topics that whether they can be bullied about or they can be their self-esteem and their confidence is affected. If you get your period too early, then oh, yucky. If you get it too late, oh, you're weak. If you get it and you get pain, they can make fun during class that, oh, you can't, you're PMSic, or you can't come with us because you are in pain. Taking history of the teen aging phase, taking history of marriage. How was the period before marriage? How was the period after marriage? How was the period after having child? That's all. It's very important. In addition to the emotional state of women, there is always a story behind the hormonal changes in women. Another piece of information that I want to add is the autoimmune. It's very, very important to relate any autoimmune diseases to corticosteroid or suppressive medication and to menses. I think I talked a lot, so I will stop now and I will give the floor back to you can, yeah, I will stop broadcasting.
Thank you, Dr. IBRAHEEM. It's really a very fine session. And as we all know that this being an important session because it the lady from menarche to menopause need homeopathic medication for easily management of her complaint. This is what the session is all about. And you have mentioned some cases also. All these cases were brilliant. And as we all know that almost all melancholic remedies are very good for managing the menopausal problems as well as the problems of the menopause also. We have a lot of patients who are having this problem, and they may have to remove the so-called uterus or fibroid for a betterment. But with homeopathy, we can manage even without surgery. That's what I would like to add to this session. Anyway, congratulations, and hope you can have some more presentation about this case, some of your cases also. So it is the time for discussion, and those who want to participate in the discussion can raise your hand so that we will allow you to unmute yourself and speak. And now I invite Dr. Amir Malik to say a few words on a presentation. Yes, please unmute, Dr. Amir.
Hello, hello. Good evening and namaskaram to all our honorable members. First of all, I have a grand thanks to honorable today our guest, Dr. IBRAHEEM. Dear honorable doctor, you are on a world number one platform, IFPH, International Farm Promoting Homeopathy. I have to request to you, please, especially the doctors from Canada, please come and join IFPH. Have bring more doctors to our platform. You can't imagine how hard working the India is in the world. You can't imagine how much the seniors doctors in homeopathy after the Germany in India there are trillions of doctors since 200 years, which are our gurus, which are our spiritual gurus, which are our homeopathic gurus. I have to say only that Dr. Kashi Ram and Dr. Dolat Singh, they are the pioneers, the kings after Dr. Frederick Samuel Hahnemann. So please, my request, you can say, have seen the cases, the chronic cases on IFPH, you will be surprised. Please see our sessions. And your lectures about your configuration, you are a great doctor. You have a great approach. You have a classical differentiation of the medicines regarding the symptoms. It is the pure royal homeopathy, which is in very few people's which are practicing in that way. And really appreciate it. You are great, have done a great session. My request to you, please come again. Please call more doctors. It will be an honor for us to have sessions from you. My prayers are with you, with a lot of prayers, with a lot of good wishes. You will please join. Today's your session is excellent. Excellent. The words are not enough. So God bless you, Honorable Doctor, and welcome to all doctors. Please.
Thank you, Dr. Amir
The
Malik.
great India, the motherland of homeopathy, the great India. It's a motherland of homeopathy. I love
Yes.
it. My forefathers are from there. I love it.
Yes, yes.
Thank you. God bless you.
Thank you very much, sir. Dr. Aya, you want to say anything more to Dr. Amir?
Yes, I just want to tell him we know how India is very, very precious in homeopathy. We learn from India. Like, I wish one day to come and visit and get all the knowledge. For attending the sessions, I will do my best to attend more.
Yes.
It's the time difference and many other things in the background, but I'm sure with time, Canada and India, we learn a lot from Indian homeopath. Just for that, for you to know, and we look at India as the source, as you said, and the pioneer or the history of homeopath. Yeah.
Yes. Now I invite Dr. Joseph Sir to say a few words on this presentation. Joseph Sir, as you all know, that he's an international teacher, always take classes for Western doctors, and he was a retired professor from Government Homeopathic Medical College, Kerala. Joseph Sir, are you there?
Okay.
Myself,
Of course, the presentation was good.
please
and,
adjust your camera a little more, sir. We can't see you. Yes.
Okay. So the presentation was very good. She already spoke about all the major remedies in the menopause, and nowadays, but see more polycystic ovarian diseases in women below the age of 30 or between the age of 15 to 30, and more fibroids and everything after the age of 30. And maybe, as she said, it can be due to the hormones in or the pesticides, everything that is used in the food, and all the farms hormones. And the thing is the chemicals or the chemical medicine or the hormones which are used for many gynecological problems also may be contributing to that, because some 40 years back or 30 years back, we had only very few cases of polycystic ovarian diseases. PCOD was, I think it was only just 1% or 2%. But now, over the years, it has grown up, and many young girls between the age of 15 to 30, if they have any menstrual complaints, we usually go for an ultrasound to see whether the polycystic ovary is there or not. So there is a change in pattern of diseases. Maybe it is due to the, as I told earlier, maybe the medicines are playing a great role, because how this is happening in throughout the world, it is happening. We can see that in Canada also. I have some patients who are having the same problem, as she said, Dr. Aya has said. See, this pattern of diseases are changing throughout the world, and we should look into that also, because why this pattern is coming up, you know, because only one reason which we see is the medicines which are administered in throughout the world from the pharma companies are almost the same. For diabetes they use metformin, then beta blockers for blood pressure, statin for the cholesterol, and we can see that the natural normal diseases which were there 50 years back is going down, 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 and in their place some other things are coming up, some other diseases are. So that also, some, as I told you, PCOD was not there, or was very, very minimal, or 1% or 2% only. But now it is increased. The fibroid uterus, I think, is reducing now. Most of the people have PCOD, and there is one relation, that is hypothyroidism, PCOD, infertility. These are a chain of things that are happening now. So all these things we have to consider, and the challenges before us are not the same some decade back, but new things are coming up, and only homeopathy, I think, can do something, because the symptoms, we can treat with the symptoms, not looking into the pathology, and that will help us to tide over or to manage new diseases and new trends in the field of medicine. Anyway, your presentation was very good. We hope you will come back to our forum again and again. Thank you.
Thank you so much. And I would like to add insulin resistance to the ones you said also. Many women now have insulin resistance related to the PCOS, related to fibroids. But again, as you said, they will come to you with irregular menses, and then you connect the dots. You understand how fibroids and how PCOS and how insulin resistance are affecting their menses. But what you're saying, the triangle of thyroid and medication and menses, and infertility, it's very, very true.
Yes, exactly. And now I invite Dr. Ramparesha to say a few words on this presentation.
Thank you, Dr. Haneji, and congratulations, Dr. Aya Ibrahim, Madam. Very good presentation, excellent session. Menstruation and menopause disease due to cause of emotional cause, dynamic cause, emotional cause, deficiency of hormones due to suppression of anger, suppression of grief, etc. Very kinds of medicine deal beautiful describe the medicine. Pulsitla, belladonna. Belladonna is the very good remedy. Or belladonna is the bod, be burning, eye inflammation, red, delirium is called name of belladonna. Belladonna is the big acute remedy. Thank you, very, very thanks. Thank you, madam.
Yes, thank you, Ramparesha sir, and it's up to Mr. Abdul Salam sir to wind up the session. I invite you for auto thanks. You can say the word of the same.
Sorry, Mr. Amir Malik will be.
Oh, okay.
Dr. Amir Malik.
Yes.
Hello. Dr.
Yes,
Amir Malik, please.
Yes, Amir. Okay. Please unmute.
Hello, honorable sir, honorable doctor. Our words of thanks is not enough for you for your sweet lecture today. It's a grand lecture. I would only request to you, please, Honorable Doctor, have a highlight on MH, AMH, FSH, LH, how to just boost in one go with the help of pituitary medicine or either Ashoka. I have found this, it will be very much helpful. And second thing, Honorable Dr. George Ishaq, which highlighted a very good thing. But I want to again say to you, from the bottom of my heart, God bless you. You have give us a very, very good session. I like it. I request to you, please rejoin. My words to praise your lecture is not enough. But I have to say, a lot of good lecture you have delivered to us. It will be a base, a strong backbone for the young students, for the juniors, and for also those who are working on the chronic and acute diseases. So nice of you, Honorable Doctor. God bless you a lot. God bless you a lot. Please remember in your prayers and join us again with a lot of more doctors from Canada to our honorable platform, IFPH. It's my kind request. God bless you, please. Thank you. Thank you. From the bottom of heart to everyone.
Yes, yes,
مشكورين دكتور آية، مشكورين جدا جدا. ان شاء
yes,
الله
yes,
نتشرف بقدومك ان شاء الله.
yes. Dr. Ibrahim, you want to say anything more to this session? You can just conclude. Yes.
Thank you. No, I hope it was really useful. I'm happy that you find it useful. Of course, it's a very deep topic. I didn't want to go very deep because of the time. I didn't know to what extent we should go deep, but I'm sure we can keep talking about it for hours.
Okay.
Thank you everyone
Okay,
for
then.
listening.
Okay, thank you. Thank you all. And
Request you to have part 2 of this
yes,
same topic.
yes,
The
definitely.
session part 2.
Definitely, there will be a part 2 coming soon by next month itself. Tomorrow, we will have a session from Dr. Davinder Singh from Canada. That is the third presentation from Canada this week. And he will be discussing about the basic books in classical homeopathy. That's a very good session. That will be a very good session. So all of you will be, hope that all of you will be there in time to watch the session tomorrow. With that, we come to the end of the day 1403. Thank you all. Good night. See you.